Hey, do you like broken appointments? Nope. No shows? Nope. Nobody does, and I understand, and I got your back on this. If you give me about 3 minutes, I'm going to go through and show you some ideas and strategies to close that gap and get more people showing up for their appointments. Hey there, have we not met before? I'm Dr. Ginger Bratzel, and I've helped hundreds of practices, healthcare practices, private practitioners all over the country to grow their practices and keep more of their ideal patients and clients. And so what we're going to talk about is the no-show rate, that thing that happens. So you have a full schedule and nobody shows up, or people break it, and it gets really frustrating. Well, I have a resource, and I'll tell you how to get it, that shows you how to reduce those and gives you a head start on it that you can start implementing. So when it comes to your appointments, we have to move these people from interested to committed. Now, some people will never make that jump, and that is all on us to figure that out, because if they're not committed to do that, then why are we giving them an appointment that they didn't ever say they're going to make? So we've got to rephrase that. When it comes to your practice, I know you do great care. I know you really love people. I know you're helping people in big ways, but that doesn't translate. When it comes to the world out there, they put us all together. And so every bad experience where they waited an hour to see somebody, that's what they think we are like. And if that's the way you're running your show and you run late, then you can never expect people to show up on time, or they will break appointments. So first of all, you have to have integrity with the time you give them. If you want them there, you've got to show up and be ready to see them. And so that's part of it. Another way, number two, is you've got to differentiate yourself from the very, very beginning. Everyone's using AI, you have autoresponders, you have computers, you have text that automatically blast out, hey, you got an appointment tomorrow at 10, show up, and if you need to reschedule, call me. There is no human connection in it. So especially if this is a new patient, you've got to think of yourself not as another healthcare practice. You got to think yourself as like a concierge experience. You've got to be over the top as far as wonderful. And I'm not talking about having herbal tea in your office and a grand piano. I'm talking about the connection you make with them. So one of the easiest things you can do is the doctor or the provider that's going to be seeing them, that new patient, calls them the day before. Not to remind, but to say how much they're excited to see them. And you can leave a message, and that's actually easier and faster for you a lot of times, but you just say, hey, I'm looking, this is Dr. Ginger Bratzel. I see you're on my schedule tomorrow, Mary, afternoon. I am so excited to see you. If you have any questions, make sure you jot them down now, but you will have my full attention when you come in tomorrow, and I can't wait to hear about your life and see what we can do to help you. That just set me out from the stage. That set me up as the kick-ass winner. It's like, I really care. I mean, we're still confirming in the front office is, we're still making sure they get all the paperwork and things like that, but that was a personal connection that set it off, and it just changes the whole platform there. That's not something an office, a medical office, a dental office, a healthcare practice would do. This is something that someone's really special does. So that's number two. Number three is, if they're coming in for a big appointment, we need to know that interested versus committed. If they're going to have to be paying a certain portion for that day, they should be able to pay to reserve it. If I'm going to reserve a hotel room at a very nice hotel, they take my credit card number down. And if I don't show up, they're going to charge me for it. It's not a breaking a rule, but I'm making that commitment. I'm not going to make an appointment and give them my credit card unless I'm really going to be there. So if you have bigger procedures and you've gone through your financial arrangements, you should get a chunk of that, their portion, and have it as a deposit that goes towards that visit. It's going towards the visit. They're just kind of prepaying to get it there. But that means they are going to be committed to follow through at that point. If it's a procedure that they're going to have a virtual visit and it's a package that you sell, have them pay in advance for that. If it's a new patient visit or new client visit and they need a little bit of information, pull those out of your regular schedule. Do a Zoom or a 15-minute ahead of time where if you lose the time, it's not going to crush you. You block those in your schedule where you make the connection with them. but you're not actually reserving time that's going to come out of your production. And it doesn't always have to be the provider that takes that call. It might be someone else in the office to see what's going on. They might just need that answered question, and then we can move on to that relationship stage there. So there's different ways to do it depending on your practice. So I have a resource that's actually customized for different types of practices. If you reach out to me and leave a comment down below and just say no show, or you can send me a direct message if you want to do that too, we will send it out to you. I will send it out to you so you can have it. I want you to make sure you have this to go forward, because I want you to practice, but more importantly, I want you to play the game of your business, your practice differently to make behaviors happen differently. This is what you need to do. So it's there. You can go get it. Hey, this is Ginger. Always love sharing insight. I want you to take action right away. You can go off and do something with what I just taught you today and make changes in your practice tomorrow.